Hi, I'm Erin DeCoste, and my presentation is on Tay Sachs disease. There are three different forms of Tay Sachs disease. Typically, the most common form is called infantile, which I will be focusing on. The development of the disease begins around 6 months of age, and most children pass away between the ages of 4 and 5. The second form of Tay Sachs is called juvenile, and there's a wide range of severity for this form, meaning that the earlier the symptoms appear in the patient, the more quickly the disease becomes worse. The symptoms of juvenile are very similar to infantile, but these patients tend to have reoccurring pneumonia as well as seizures. The third and most rare form of the disease is called late onset because it occurs later in life. And sometimes it can be difficult for it to be diagnosed since its symptoms can be very similar to ALS. Unlike the other forms of the disease, late onset does not always shorten the span of the person's life, and symptoms can be managed. Focusing more on the infantile form of Tay Sachs disease, it is a genetic condition that is fatal in early childhood. Infants that are affected lack the enzyme called HexA, and the mutation is in both copies of the gene, which basically means that the patient receives a mutation from their mom and their dad. The mutation creates an issue where the individuals are now unable to break down gangliosides, which are toxic chemical compounds found in the brain. These gangliosides begin to accumulate in the brain over time, which damages the nerve cells and causes progressive deterioration of mental and physical capabilities. Now I will be getting more into the physical disabilities that occur due to infantile Tay Sachs. Typically, infants appear normal until around 3 to 6 months of age, and by this time, their development begins to slow and muscles weaken that are used for regular movement. Children also lose normal motor skills for infants, such as turning over, sitting, and crawling. They also develop an exaggerated startled reaction to loud noises. Once the disease starts to progress even further, patients will experience seizures, vision and hearing loss, intellectual disabilities, paralysis, and an eye abnormality, which is usually called the cherry red spot on the retina, which is normally a part of how doctors will diagnose this disease. Here the genotype is shown in a Punnett square. If both the mother and father are carriers of the disease, there's a 25% chance that they will have a child affected by Tay Sachs. Now to talk about Tay Sachs biological pathways. Tay Sachs inhibits the metabolic pathway of an individual because the lysosomal storage mutation in the disease does not allow the enzyme to form. Therefore, the absence of HexA allows the gangliosides to accumulate in the lysosomes. The gangliosides block neural pathways, which leads to the destruction of cells, and when these dead cells accumulate in the brain, it can lead to Tay Sachs disease. As stated before, the disease is caused by a mutation in the copy of the HexA gene. This occurs on chromosome 15. The disease is inherited in an autosomal recessive manner, meaning that a person receives a non-working copy of the HexA gene from both parents. Shown in the pedigree on the right, if both parents are carriers, there is a 25% chance a child is affected, a 50% chance a child is a carrier, and a 25% chance a child is neither affected nor a carrier. Within the United States, there are about 16 cases that are diagnosed every year. The individuals that can be more prone to Tay Sachs are families of Eastern European Jewish descent, who have 1 in every 27 person as a carrier. The French Canadian and Cajun community of Louisiana have been found to have the same carrier rate. Also, among Irish Americans, the carrier rate is about 1 in every 50 people.